Hello.
So I was just printing up the big latest numbers for you.
Okay, thank you.
Mhm.
So, how you doing?
I'm okay. It's raining, so my F-45 class has been canceled.
Oh yeah. So, I've
So
been,
I have,
how many times a week are you doing that now?
well, okay, last week I started, so I did it 3 times. So if I can get it done twice a week, like that would be good.
You did it 3 times last week?
Yeah,
That's crazy impressive. Okay. That's really good.
I'm
I like
hoping
it.
2 would be good. I just happened to, you know, my daughter got me out of bed twice, and once we did it in the evening. So
I
I just
like
like
I like all your F-45 posts. So, but let me start off with a question then. Okay. So, yesterday Doug Ford came out and said that the Halton region will not be going into a stage 2 light lockdown. He also did say that all the mayors in the Halton region pretty much said that they didn't want it, right? But he also did say, and I'm not sure if this is kind of broken telephone or just lost in translation, but Doug Ford also did say that the regions that got into stage 2 light, which would have been Toronto, Peel, and Ottawa, did want this stage 2 light. Did you want this?
well, that's a little bit of a stretch. I mean, I'll do it for public safety and for the public good, for the health and well-being of the community, which is how it was presented to me. However, my mother keeps texting me, how do I get on? Uh, however, I have also been saying, and I think the business community knows this, that restaurants and pubs and gyms are not the source of our spread, period. And so to close down small businesses like restaurants and gyms, um, I didn't agree with. I agree with, limiting capacity, maybe, making them close a little earlier, because we have not traced one single case to a restaurant or a gym. And in fact, uh, the municipality where there was transmission in a gym, the Spinco in Hamilton, they closed that, cleaned it, and reopened it because the gyms don't have to close in Hamilton. So I felt that it was highly punitive, and Mayor Brown feels the same. But we are suffering from very high case counts. And I want to review those with you, and then I can put all the papers away, and that'll make me feel good. So let's talk about outbreaks first. Workplace,
Yeah.
workplace outbreaks is still very, very small. Um,
So over the last 2 days, well, sorry, this I guess the last 2 days, meaning Sunday and Monday, there were 400 cases, correct?
Yeah, well, let me walk through that in 1 second.
Okay.
So, yeah, household contact is still 47% of our
Okay.
cases, and the other half, 49%, is still community transmission. So we know there were some super spreader Thanksgiving dinners. We know of one in Brampton where family from Quebec came in, brought the virus with them, and infected everyone there. We know of a Thanksgiving dinner in Vaughan that infected a couple dozen people as well. I don't have any specific stories about Mississauga, but Thanksgiving seemed to be the trigger of the case counts tipping up. So if we look, I mean, today was not a bad day. 53 in Mississauga, but 191 in Peel. So 100.
100. Wow. Okay.
There were 53 only. Yesterday, too, only 55. But Saturday and Sunday were awful. Were just awful. We had 77 on Saturday, and if that wasn't bad enough, 81 on Sunday. I was getting worried. But then Monday, things went back to normal. So I think it was a blip because of Thanksgiving dinners. And that's why I'm being hopeful. Like last week, we were still doing okay. We were averaging last week 54 cases in Mississauga. And in Peel region was averaging, oh, it got cut off. I can later.
I guess at the end of the day, it is an overall Peel number that unfortunately Doug Ford looks at, right?
That's the problem. That
Yeah.
is exactly the issue. We are one health unit, Peel. Now, if this trend continues after the 28 days, where we are one fraction of the numbers represented in the COVID numbers, then of course I'm going to ask him to reopen the restaurants and bars and everything that's had been rolled back to stage 2.5. But unfortunately, he's going to say, well, Peel region. There was the example of Windsor and Essex that were one health unit, but separate because circumstances were different in each. So, I mean, if this trend continues, where we see double the numbers in Brampton, and Brampton has some unique circumstances. I know you've been speaking to Mayor Brown, and you know they have some very large manufacturing plants that are some of the source of spread there, and more people in the transport industry crossing the border. And frankly, they have large family households too, and that also is a spread of the virus. And
so, Mayor Crombie, are you saying that come November 7th, if the numbers are lower in Mississauga, you're going to ask the province and Doug Ford to open up Mississauga outside of Peel?
I would love to say that, yes. I would love to deliver that message, and that will happen if the numbers continue to be stable and not fluctuate up to 70, 80, 90, 100. If we're in the 50s or lower, yes.
Okay.
May happen is we have to continue to watch the numbers, and people need to continue to be vigilant. So what I'm hopeful, I don't have my earbuds on, is that okay? I forgot to sing.
No, you sound fine.
Sound fine? Okay. You know, so the 3 municipalities, Toronto, Ottawa, Peel, that went into phase 2.5 for 28 days should be clear by November 6th. Now, York was put in a week later, so they won't be out till, what, the 13th? Or later, because I think it was a Monday they went in. It was a Monday.
It was a Monday.
Announced it on the Friday, and instead of making it effective at midnight, he gave them, the restaurants, the 2 days, you know, to clear their agenda and clear their inventory and food. Because remember, what happened here is all the food got donated to the food bank in many cases, fresh foods. So they learned a lesson that restaurants do need to be given a heads up when announcements are made. It's only fair. So I think what may happen is that he may say, okay, well, let's give it one more week and wait and see what happens after York, you know, their 28 days. But if our numbers are stable and 50 and lower, and we have capacity in our hospitals and we have capacity in ICU, I mean, this is the difference between, you know, wave 1, phase 1 and phase 2. Now that we're officially in phase 2, by the way, in Peel, is that we saw the surge in the hospitals, and the death rates were higher, and hospitals were being used almost exclusively to fight COVID, and ICU rates were full. Now we aren't seeing that. People are, and we think it's because they're young people who are contracting COVID or younger, more resilient, and not being hospitalized. So hospitalization rates are lower. Death rates, of course, are much, much lower. And the people in ICU are much, much lower. So this is all good news. So we have learned a lot on how to combat the disease, but the age getting affected is lower. And so it's the symptoms are less severe. So this is good news that hospitals can treat patients for, you know, other problems rather than just COVID. So that's very important that we do have capacity in the healthcare system and in the public health system too. We've kind of got testing under control, and contact tracing. We did ask for more contact tracing, for more assistance, and we've made the application for the isolation center as well.
Okay.
So we're in good shape. We're not in great shape. But I'm hopeful that the trend will continue to decline, that the blip was just the 2 weeks post-Thanksgiving where people took some liberties and got together with their families and shouldn't have.
So good enough shape for the economy to fully open back up in Mississauga by November 7th?
7th or 13th, right? Well, at least the bars, restaurants, and the gyms.
How much?
And then,
how much?
It may implement more restrictions, the capacity limits, and maybe even earlier closings. But that's far preferable than to be, you know, shuttered and completely, other than for patios. And patios have been a little bit challenging too, because we have seen the tents spring up across the city, and we see all four sides are up, and then propane tanks on the inside, and it's a concern. We have seen that. Our bylaw enforcement has seen that. So basically, you have indoor dining, but outside, being heated by propane heaters, and of course, that's not allowed. There has to be ventilation. So if you are outdoor dining in a tent, please be aware that you do need ventilation. And if the restaurant where you're dining doesn't have the end sides up, or the top open and one side up, then they are breaking the rules. That's not what was intended for outdoor dining, right? Because you do need airflow, and you aren't getting it if all four sides of the tent are down.
How much, you're at F45, I'm sure you're doing takeout at restaurants and stuff. How much pressure are you getting from these businesses to open up?
Well, certainly a lot. And I know that our tourism board met yesterday, and there was a lot of frustrations, you know, among the members who represent the hotel industry and those representing the restaurant industry. And as you know, I live in the south end of the city, so there are restaurants for Port Credit represented on the tourism board, and there's a lot of frustration. And you know, we're hearing some of their plight right now, and the banks aren't being very kind to them either. Certainly, the programs that have been announced by the federal provincial government for assistance, you know, the rebate program for property tax and for fixed costs, including heating, those aren't even open for application yet. So the money isn't getting out soon enough. So we heard some of those frustrations yesterday. And, you know, it is tough. Like, I think about my restaurants on the Dundas Street Strip corridor. So on the north side of Dundas is Mississauga, which are closed. But if you look on the south side is Oakville, and they're watching patrons go into restaurant dining, right? And it seems so basically unfair to them, but you know, I know where they draw the line. That, and we know that there are large employers that we all use, some of the big box, we won't name names, that have had incidents of COVID, and the person is isolated, and the store is cleaned and it reopens, and yet the same isn't extended to the restaurants. And I guess the rationale for the restaurants is that people are seated and they remove their masks, and they're seated for a long period of time. Unlike, for instance, in a grocery store or a hardware store, where you may pass someone in the aisle, but both of you are masked. So much lower risk of transmission than sitting across someone who could potentially be COVID positive, and you're seated with them across a table without your mask for long periods of time. Because they're saying now that, you know, about 15 minutes it would take for that transmission to occur. So, I mean, I understand it. It just disappoints me, and only because they've worked so hard. They're really trying to survive, and there has been no incidents that we can point to in the evidence and the data that's presented where one of those businesses, restaurant or a gym in Mississauga, has been the source of any transmission. So it is deeply frustrating to me, yet we know that the protocols right across the world, right across the globe, are that restaurants are closed first. And you've seen in Europe, there are actually curfews in many places where people have to be home inside, whether it's 6 o'clock in Scotland for the pubs or 8 or 9 p.m. in France or Italy. They can have indoor dining in restaurants, but they close down quite early, or much earlier than the Europeans are used to in any case. So, you know, it's part of those best practices because people do congregate. It's considered a congregate setting where people come together and sit and remove their face covering, and the opportunity for risk of transmission is much higher. So I understand that intellectually, but it's killing me because I know how they're struggling. I know how they're struggling, and I know the banks are calling them, and they're worried about their rent, and they've got to lay off people, and the subsidies and grants aren't available fast enough and aren't getting to them. And they're all asking the city, and I have to, you know, disappoint them by saying that unfortunately the city is not in a position, we're not permitted by the Municipal Act to provide grants and subsidies. It's considered bonusing, and we're not allowed to provide businesses with grants and subsidies. So, but the provincial and the federal government do have programs. And if anyone is interested in any of those programs, then please go to our Economic Development Office, Mississauga.ca at EDO, Economic Development Office, and they're all listed. Any of the programs you might be eligible for, or give them a call, and they'll be happy to walk any of those businesses through the programs that are available.
So I'm not sure if you heard, but there was a report that came out in the Canadian press that said that in Quebec, 200 gyms are going to defy the, the closure, and they're going to open up. Not that I've heard anything that's going to happen like that here, but I mean, what would happen in a situation like that if that were to happen, where, an industry just said, you know what? Sorry, guys, we have to do this just to stay alive.
Well, I hear you. So because it's a provincial protocol, but we do the enforcement, we would be forced to go in and fine them.
Okay.
You give them a notice of contravention the first time, but if you go back a second time and they're open, they get fined. And those fines could start at $10,000, be higher. It could be $10,000 a day. It could be $100,000. They'll set the fine limits, but that would be enforcement would be on us. But I hear from many people about opening up the economy, and there is a misperception that it is our responsibility to open restaurants, and it's not. It wasn't. We didn't close them. We fought strongly that they stay open. And unfortunately, the decision was made that Peel is a hotspot and Mississauga is part of the Peel Public Health Unit, and that we would have to close. So it's a provincial regulation that applies to us that I can't overturn, obviously. So we're waiting, and we're hopeful that the numbers will come down and we'll go back to phase 3, let's hope by mid-November, if things continue on the same path, on the same continuum that they are now. And then, 50 or under is good. Let's get to 30, and let's get back to 25, and let's get back to 15. There were times where, there were weeks I had averaging 4 cases a day, 2 cases per day in August.
I remember when there was 0.
0, right?
Yeah.
So we can't get there again. We can.
So what would you say to, the people in Mississauga? Like, how do we get the numbers down to that? Like, obviously, the cleaning hands, stuff like that, we know, but like, what else do we have to do?
So now they're saying instead of 10 people permitted in your house, it's 6. Like, limit yourself to your immediate family. It's back to the lockdown where it's your essential workers, your essential supports, and your immediate family. It's just, we're at home, and so we think, oh, let's get together with friends. Do it virtually. Don't go to their homes. You just don't know. The problem is everyone thinks they're healthy, and 9 out of 10 times they are. But there are people who are asymptomatic, which means they don't present symptoms. And they could be carriers of COVID, and you could contract COVID from them and not even know it, and then become symptomatic yourself and need treatment. So it's very risky business. This virus is insipid. It moves, and we don't even see it moving. So we just need not to socialize is really the key here. Stop with the dinner parties, stop with the backyard parties, stop with the hanging out at the mall with your friends, or the coffee chats. Do the coffee chat over online, virtually. You can still do that. It's the socializing, really it is. It's going to each other's homes, passing it on in different households, and just getting together with people. And we know, we predicted what would happen at Thanksgiving. That people would, just this once, have the family together again. And
are you concerned that
that 2-week lag, right? There's the 2-week lag. So it's very easy to trace back what the numbers this weekend were a result of. It was 2 weeks ago, which was Thanksgiving.
True. Week over week, the numbers have not been going down, unfortunately, though. So how concerned are you that, restrictions could be pushed another 2 weeks or 3 weeks or 4 weeks or, into December? Like, are you concerned?
I am concerned. Of course I'm concerned. I don't want to see another lockdown, and, I think it's very punitive for people's lives. We have entrepreneurs that their heart and souls are in their businesses, and they're being asked to shutter, and and lay off people. So we've got to do it for them. You know,
Yeah.
we've just got to do it for them. Think about it. You know, your favorite restaurants that are going to go belly up and close their doors, and all those people will be unemployed. All your favorite friends and waiters, you know, takeout and delivery, and even takeout delivery. People pointed out that people are starting to socialize in the lobby of the restaurant or out front as they're waiting for their food. Please just get it delivered. They'll drop it off at your front door, open the door, and have your meal. So it's another opportunity. Whatever opportunity for congregating or socializing, just try to eliminate that. Stay home with your immediate family and most essential supports, right? Of course, your babysitters, support workers, PSWs, etc. Of course, and that's it. That's it.
Anything going on with the testing, COVID-19 testing in Mississauga? Anything new, or is it just any more pop-ups or?
No. So they're doing, I think I heard yesterday, you know, in and around 1,000 a day at Trillium Health Partners.
Okay.
Yeah, and then we have capacity for about another 400 at the 8 pharmacies as well. I guess they do it every 15 minutes or so. Yeah. Okay. Yeah. So there is capacity to do testing. All you have to do is either go online or call, and you do that each morning. The spaces open up each morning. You can go in and get tested. I know people who, you know, just to take a precaution, had a test yesterday, had a test today, someone else, and that was just for precautions. They thought they may have come into contact with somebody who had tested positive. And yesterday they were negative, and I'm quite sure today they'll be negative too. But you just email or call that morning, and you make your appointment, and you go. And of course, if you're symptomatic, you go to the hospitals. If you're asymptomatic, just concerned, then you go to the pharmacy. If you're a healthcare worker, an essential worker, frontline worker, of course, your risk of transmission is higher, so you would go to the hospitals.
Mayor Crombie, those are all the questions I have. Is there anything else you'd like to talk about?
You know, I'm hoping that one day we'll have a conversation that won't involve COVID restrictions. We'll be discussing the vaccine that was created, and you know how people will go in and become vaccinated to protect themselves and their families, and what life will look like post-COVID, and how we can go back to the business of the city. And we're building a fantastic city here, and we've got so many great developments, particularly on the waterfront, in our downtown, along the Huron-Ontario corridor with the LRT, on the 9th Line corridor, and focus on those things. Focus on building a great city rather than just worrying about managing people during a pandemic and managing their interactions. Social interactions is what we've been, you know, the advice that we're giving. And, you know, Halloween is coming. We know the kids are disappointed. Then Remembrance Day, and then we've got Diwali, right? And then we'll have Hanukkah and Kwanzaa and Christmas, and one after another. Hopefully, I'm still hoping we can celebrate with our family and friends at Christmas, but at this point, it's not likely. Let's start to take it more seriously.
I'm assuming all events would be canceled. Remembrance Day, I believe, will be virtual. Is that correct?
At the City Hall will be virtual, but there are still the Legions are organizing 25 people, which is permitted outside in front of the Cenotaph. Of course, there'll be no parades. We do the marches in a normal year. So there'll just be a very small gathering of 25 invited dignitaries at each of the cenotaphs. The Legions will be represented, etc., armed forces, etc. I think that we're still coming to terms with that. We were discussing it today, but we've been checking in with the Legions as to what their plans are, and most of them intend to go forward, but with something very scaled back. Yeah.
Okay. One day, I predict in 6 months' time, we'll be talking about events that will be going on at Celebration Square.
Yes, wouldn't that be wonderful? Yeah. Hey, we have a U.S. election next week. We can talk about that too.
Okay. We'll talk about that next week.
Yeah, that's right. We had by-elections yesterday. Those were interesting results too.
Oh yeah, yeah, true. So, Mayor Crombie, thank you so much. I will see you. Enjoy your F45. Don't get too sore. Make sure you stretch.
Yeah, not today, but it looks like it'll be canceled with the rain, but hopefully later this week.
Okay, take care.